Today we'll be discussing which medications can cause erectile dysfunction.
Hi, I'm Kelvin, and I'm one of the wellness professionals here at the Novus Center.
And I'm Stephanie Wolff, PA and CEO of the Novus Center. There are quite a few medications that can cause erectile dysfunction, whether it's because it's causing vasoconstriction of the blood vessels, or perhaps it's reducing the amount of flow and pressure of blood through your blood vessels, or maybe it's just messing with the brain and the amount of dopamine and oxytocin that you're supposed to be releasing in order to have an erection. So we're going to get into that next. One of the first medications I want to discuss is Finasteride or Propecia. Finasteride is used for several different reasons, one of them being perhaps an enlarged prostate. It has been shown to help reduce symptoms of BPH or benign prostatic hypertrophy. It's also used to help with blood pressure as well as hair growth. Some men will come to me who've been placed on Propecia for years to help with their hair loss and their hair growth. But something you don't realize is Finasteride or Propecia actually inhibits a hormone that's called dihydrotestosterone or DHT. Dihydrotestosterone actually comes from testosterone. So you need to make enough testosterone in order to convert into an active metabolite or even a stronger androgen than testosterone itself, called dihydrotestosterone or DHT. You need dihydrotestosterone in order to have erections and have a libido, build muscle, have prostate health. You actually have cells in your prostate that are specific for dihydrotestosterone. So when you take something like Finasteride, it completely cuts off that conversion. So you're no longer making any dihydrotestosterone. I mean, absolutely none. I'll have men that come into the practice where it's undetectable. There's nothing going around in their blood system showing that they have dihydrotestosterone. And what happens is you don't have enough dihydrotestosterone, you'll have decreased libido, you'll have erection problems, you'll actually have an enlarged prostate, you'll have BPH symptoms. So it's really doing the opposite of what you think. The other thing that happens is there is a syndrome, and it's called post-finasteride syndrome. I can't tell you how many patients have come through my clinic who are suffering with post-finasteride syndrome. It's actually a real thing. You can look it up. There's clinical studies on it. But once these patients get off their finasteride, once they start to experience these symptoms, there is a select few who those symptoms never go away, which is why it's called post-finasteride syndrome. So they will forever have this loss of libido, erectile dysfunction, decreased sensation, but they can also have other things too, like muscle atrophy and depression, dry skin. So if you think about that's what it's causing long term, that's what it's doing short term while you're taking it. Now I want you to think about this. Think about some of those other clinics, such as Hims and Romans, who are actually helping to treat erectile dysfunction by giving you guys Viagra and Levitra and Cialis. But they also prescribe Propecia or Finasteride. So don't you find that interesting? A company that's going to help treat erectile dysfunction is also more prone to give you a medication that can cause erectile dysfunction? I just find it a little interesting. The second most common medication that can cause erectile dysfunction is blood pressure medication. And specifically, there are two that I want to talk about. The first one being beta blockers. Beta blockers typically end in OLOL. So metoprolol, atenolol, propranolol, those kind of medications. And they are used, number one, for controlling heart rate and rhythm. They're also used for angina, they're used for atrial fib. They can also be used for migraine prevention. But think about what they do. They're called beta blocking receptors. Now, in order for you to get an erection, it's a whole process. And the first process starts at the brain. It starts with sensation, your senses. So you have to be thinking about it. You have to smell it. Maybe you touch. It's seeing it, visual. So you're activating all of your senses. And when you do that, you start to release dopamine and oxytocin. Dopamine and oxytocin will then send a signal down your spinal cord that's called nitric oxide synthase. And this is an enzyme that will then convert into nitric oxide in your blood vessels, causing vasodilation. But you also have to have vibration or sensation stimuli to the penis to also promote nitric oxide production in the blood vessels, but also acetylcholine. Acetylcholine is another neurotransmitter that's activated in your brain, but only after the penis has been vibrated or touched. And when that happens, that's going to activate the autonomic nervous system. The autonomic nervous system is responsible for both your parasympathetic and your sympathetic nervous system. We learned about this in grade school. The parasympathetic is what we call rest and digest. So when you're watching TV and you're just relaxing, you're calm, your blood vessels are dilated, your heart rate is low. You need all that to happen in order to get an erection. Well, the way it happens is by activating your beta receptors. So if you take a beta blocker, just as the word says, it's going to actually inhibit those beta receptors from being activated by your parasympathetic nervous system. Therefore, you're no longer going to have that vasodilation and you're not going to have an erection. So that's number one. Number two is a diuretic. Diuretic is another blood pressure medication that's commonly used, and it does just that. It reduces fluid. And when it reduces fluid, that means it's also reducing the amount of blood flow to the penis. So those are just the two most common blood pressure medications that can cause erectile dysfunction. There are many other medications that can cause erectile dysfunction. So I've provided a graph for you so that you can see exactly what I'm talking about and perhaps see what medications you might be taking that's causing your erectile dysfunction.
If you believe you've developed erectile dysfunction from your medication, ask yourself these two questions. First of which, did I have any problems with erections before this medication? Secondly, have I noticed a decline in my erections from after taking the medication? If you answered yes to either of these questions, the medication might be the cause of your problem. We recommend getting a personal step-by-step plan for reversing your erectile dysfunction. To do so, go to getmyprotocol.com. And if you'd like more information on medically induced erectile dysfunction, we've made a video for you here.
Now, as a disclaimer, we're not recommending you stop taking your medications, but please consult your medical practitioner and see if there's something they can do to change your medications. We've left clinical studies to the topics we've discussed below in the description. We hope this helps.